I think what the tour today really highlighted for me is that it's so important for us to think of HHS and everybody who works here as a giant team, and that the work of our greatest, most brilliant surgeon can quickly be undone if we're not doing a good job here in processing and reprocessing medical devices. So we have a big team. Everybody has a really important role to play. We're all going to have to pull together in order for everything to work, for us to be as good as we can be. Hi, I'm Rob McIsaac.
And I'm Krista Boyle, and I work here in the Medical Device Reprocessing Department at the General Site.
Krista's about to give me a tour of MDRD and just let me know how things are working here.
I was on vacation in, I believe it was in Cuba, and I had met a couple of nurses. They were working at Toronto General at the time, and they asked me what I had done, and I was telling them that I do all the cleaning and sterilizing of the reusable equipment. She had no idea that there was actually somebody within her hospital that was doing that. I always say that we're kind of like the magic fairies in behind that nobody really sees. We don't have the direct contact with the patient, but we do have direct contact with the patient with everything we're touching. Everything goes through those washers, and that way it's high-level disinfection enough for the assembly staff on the other side to be able to touch it with their bare hands. Everybody back here, as you can see, is completely gowned up. Over there we have no protection, so Katerina's our starter to breaking the line of infection there. So here has a list of absolutely everything belonging to this tray. So our techs obviously have to know the difference between all of the different forceps, all of the different types of scissors that are used, all the different clamps. We need to know the names of them in order to be able to set them up correctly. So this is almost like a recipe book. You go through and you're going to make sure each of the instruments, it tells you how many you have to have. And on the computer here we mark that it's present. You're going to go all the way through the tray, set it all up, and when you press the check mark at the bottom, it will print you out a label which will also have a barcode on it. So at this site we have 4 autoclaves. So all of our steam sterilizers are run at 132 degrees Celsius.
It's been a hard day's night, and I've been working like a dog. It's been a hard day's night, I should be sleeping like a log. But when
So once everything comes out of the sterilizer, we put it into this area here, and this is our cooling area. So everything that comes from steam sterilization has to be left for at least 1 hour before it can be touched by the human hand, otherwise it's considered contaminated. So we put little notes on the end of everything to tell you what time that you're able to touch that at. Each of the cases for the day, we have a master list that sits on this desk here. So these are all of the surgeries taking place in the operating room today. And each of those cases, we pick a specific case cart based on surgeon specifics and what they want on that case cart for that patient. So we picked the day before. They started getting all of these case carts ready starting at noon yesterday, so that they would be ready for 8 o'clock this morning.
As always, what I see is great workers who are passionate and dedicated to the job that they're doing, sometimes with some frustrations. And so I think the challenge and the opportunity for us going forward is really to make sure that people have the tools that they need to do their job. And if we do a good job at that, everybody's going to be a lot better off. So thanks a lot, Krista, for a great tour today of MDRD. And if any of you want to invite me to come and see where you're working, please send me a note. And I'm going to get to as many as I can. Thanks a lot.